This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Hope everyone had a great weekend. Mon Health Talk. I'm Dave Wilson. Today we're going to be talking about gynecology services, OBGYN services in both Morgantown and Hopwood. So joining us on the show this morning is Dr. Shane Prettyman, OBGYN with Mon Health in Morgantown. Good morning, Dr. Prettyman.
Good morning.
And we have Dr. John Sunyecz with Mon Health OBGYN in Hopwood. Good morning, Dr. Sunyecz.
Good morning.
Guys, thanks for taking a minute with me. I hope everyone is ready. I hope you've got all the gifts bought and wrapped, guys. We're less than 5 days away from Christmas here.
It's crunch time, that's for sure.
We're ready. We have good wives.
Now, don't we all? Christmas for me is as exciting to watch folks open up their presents because it's a surprise for me what they're getting from me as well. So
I can relate.
Well, guys, thanks for taking a few minutes with me this morning. And we're going to get into OBGYN services being offered in Morgantown and up at Hopwood. So let me flip a coin here. We'll start with Dr. Sunyecz. Tell us about yourself, education, training, how you ended up with Mon Health.
Sure. I'm originally from Northeast Ohio. I completed my medical school at Ohio State and performed my residency at McGee Women's Hospital in Pittsburgh. Upon completion of that residency, I moved to Uniontown and began practicing, and I've been here for over 20 years. We originally were in private practice and then approached Mon Health about 2 years ago and have joined with them based on their reputation, quality of care. It was a great fit for our practice to join Dr. Prettyman and his group and have care out of Hopwood as well.
Now, let folks know exactly. You're located up in Uniontown?
Yeah, right near Uniontown, Hopwood, a small little village, if you will, right at the base of the mountain, actually convenient to Route 43 and 40. So, yeah, in Hopwood, Pennsylvania, near Uniontown.
All right, and Dr. Prettyman, I know you've been on the show as well before, but give us a little bit about your background.
Sure. I grew up in West Virginia, did undergrad in medical school here in Morgantown, went to the University of Virginia for residency, and after completing that, moved back to Morgantown, and I've been working at Mon Health since about 2011.
Now, are you located in Morgantown? Do you see patients in other parts of the state as well?
Sure. So, primarily in Morgantown, yes. But over the last few years, we've been expanding, kind of working with Dr. Sunyecz and his group in Hopwood, as you mentioned. Also started working out of an office in Fairmont. So we have an office in Fairmont that's a very busy office that we work in. We also work, again, in collaboration with an OBGYN doctor in Weston at Stonewall Jackson Hospital. And soon going to be starting to work with Minnie Hamilton Hospital in Grantsville near Glenville in the central part of the state, going down there, seeing GYN patients, just to try to expand our reach to just access more patients so they can have access to Mon Health systems and their affiliated clinics and hospitals.
Why is it so important to have those satellite clinics, whether it's Weston or Fairmont or with Dr. Sunyecz up in Uniontown? Why is it important to have those available outside of just the main Morgantown area?
Yeah, I mean, I think so. The majority of your care does not have to be in a hospital. So you don't need to be near the hospital here in Morgantown to receive routine office care and even a lot of procedures. So I think patients conveniently go to clinics near their house so they don't have to travel, whether it be after work or first thing in the morning before work. And a lot of people know the reputation of Mon Health system and don't necessarily need or want to come to Morgantown. So if we can get out to them, we're serving them with our reputation. If they do need to come to the hospital for care or surgery, they can. But, the majority of their care and maybe preoperative care can be done closer to home.
Talking to Dr. Shane Prettyman, also Dr. John Sunyecz, OBGYN in Morgantown and Hopwood. Mon Health Medical Center has been named a Center of Excellence in Minimally Invasive Gynecology, and kudos being recognized Mon Health surgeons as well. So I'll throw this one to you, Dr. Sunyecz. What does that mean first of all, minimally invasive, and what does that honor mean for the patient?
Well, yeah, so minimally invasive procedures in general is surgery, done basically using smaller incisions and fewer stitches, if you will. Essentially, most procedures done in the past that required, larger incisions can now be done in a minimally invasive manner. So the Center of Excellence designation, it recognizes in our field gynecologic surgeons and the facilities, medical facilities that demonstrate this commitment, which is really unparalleled, and its ability to deliver, safest and highest quality surgical care for our gynecologic patients. Really, we're the first and only in West Virginia, coupled with the Mon Health or the first and only robotic Center of Excellence, that it's focused on these outcomes and patient care that is best for the patient.
Give me an example of a minimally invasive procedure a patient may be an option for.
Well, hysterectomy is probably the most common thing that is thought of. So in the past, as I mentioned, large incisions, 5 to 7 days in the hospital oftentimes. Patients would have difficulty with recovery, getting back to work, taking care of their family, doing their normal daily routine. With minimally invasive hysterectomies, it's generally 3 to 4 small half-centimeter really incisions that are done in a much more efficient manner. So those patients oftentimes can go home the same day of their surgery and once again can have an easier time recovering. They have better outcomes, it's been shown, less infections, better pain control if you're at home. So really patients have given a great amount of satisfaction when we've asked them how they did with their procedure, how they recovered from their procedure. So oftentimes patients can tell friends, family members how well their procedure went, and they really enjoy recovering much more quickly.
And Dr. Prettyman, when you think about a hysterectomy, and like a lot of procedures we talk about on Mon Health Talk each week with physicians, what were once major ordeals that would require a couple of days stay in the hospital, you're talking about possibly going home same day, being able to recover at home, being able to feel better in a few days, and that all goes back to these advances and the minimally invasive procedures.
Yeah, I would really say probably over the last 10 years or so, the focus of medicine in general, surgery in general, has just been more minimally invasive. And I think a lot of patients know that, those that have had care see that firsthand. But I think there's still a lot of patients out there, yes, hysterectomy is a major surgery. Don't get any of us wrong. But, the manner in which it's done, I think most patients, aren't realizing that it often is a same-day surgery. I'd say, 2 years ago, pre-COVID, most of our laparoscopic hysterectomies, which realistically are the way probably, laparoscopic or vaginal hysterectomy, because that's also a minimally invasive surgery, are the way that 95% of our hysterectomies were. And most patients would say a day in the hospital. Some patients, maybe half of them, would still go home the same day. But with COVID and trying to keep patients out of the hospital, it's really transitioned to same-day surgeries. And I think doing that has given, doctors and nurses and patients kind of the confidence that most of the time you are, you do surgery in the morning, and that evening you are good to go. Sure, you have some discomfort, but it's no more so that evening compared to the next morning or the next morning. So patients really do well, and I think, like Dr. Sunyecz says, they're very pleased at how well they do after these surgeries.
Dr. Prettyman, how common are hysterectomies?
Yeah, so probably about a third of women, I think is the statistics that's thrown out there, will have hysterectomies at some point in their life. And realistically, it probably depends on the patient's, tolerance of their symptoms. Some patients have very, heavy bleeding and or discomfort, and they've been like that their whole life, and they're tolerant of that, and they may not want surgery. Others are less tolerant. So I think, a lot of, will a woman have a hysterectomy is probably not so much statistically or what will happen to me in my life. It's probably more so their tolerance of their symptoms. And there are many, things that we can do other than hysterectomies. I mean, there's other minimally invasive procedures that we can do, endometrial ablations that can help decrease the amount of bleeding and sometimes discomfort patients have with hysterectomies. And obviously, medical and hormonal things that can be done just with office visits in the office that don't require surgery. So, we have lots of tools in our bag. It's not always just surgery to treat these patients.
Dr. Shane Prettyman, OBGYN Morgantown, and Dr. John Sunyecz, Mon Health OBGYN Hopwood are our guests this morning. And we'll continue our discussion right after this. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Guest this morning, Dr. John Sunyecz, Mon Health OBGYN Hopwood, and Dr. Shane Prettyman, Mon Health OBGYN Morgantown. Gentlemen, thank you for taking some time this morning. Dr. Prettyman, Mon Health Medical Center is considered a baby-friendly birth center. Tell us more about what that means and what that means for both mother and baby.
Sure. Baby-friendly is I believe, an international designation that hospitals can apply and be chosen for to really promote breastfeeding. So it's started as kind of a breastfeeding promotion program, if you will. So it's to recognize, but also to try to change practice patterns within a hospital, so that they're not, the big companies of, formula and all that type of stuff, that sometimes, get access, to hospitals and promoting and setting ads and really potentially discouraging breastfeeding by not promoting breastfeeding. So it's knowing that, breastfeeding, if you're able, is the healthiest form of food for a baby. It's to try to educate patients in the office, educate them in the hospital, have our hospital set up to encourage breastfeeding, multiple steps to do that, be skin-to-skin contact immediately after birth, maintaining that skin-to-skin contact, initiating breastfeeding as soon as possible, avoiding things like pacifiers and bottles when able, and just really promoting breastfeeding. So it was a designation we achieved a couple years ago. You have to maintain that certification. We were the first hospital in the state to achieve that, and it was a really significant honor, but more so, I think, the right clinical care to give for mothers.
And Dr. John Sunyecz joining us as well. Dr. Sunyecz, can you explain to me, and I don't even know if I can say this correctly, what is endometriosis and how that is treated? Did I say it right, first of all?
Hey, you get 100% on that. You did,
Not
did
bad.
Excellent. So, yeah, it's a very common condition. It's a chronic and can be very painful process that occurs when the tissue that lines the lining of the uterus grows outside of the uterus where it doesn't belong. And when that happens, it's stimulated by some of the hormones that are produced, mainly estrogen, during a menstrual cycle, and that can lead to a lot of inflammation and pain in those individuals. About 2 to 10% of women are affected with this issue or disease, if you will, and like I said, it can be very chronic and debilitating for a number of women. So it's one of those things that if it's identified sooner than later, it can be effectively treated. It can be treated hormonally with medications. Sometimes you need to pursue surgery to try to remove as much of the endometriosis as possible. So hormonal treatments are effective. Surgical treatments are effective as well. Most common symptoms for patients are painful periods, significant cramping with periods. You can also have pelvic pain that develops between or outside of your period. And then the third most common thing we see patients complain of or note is discomfort with intercourse.
Guys, I've saved the at least the most politically charged question for the end, but I know it's on the forefront of a lot of young mothers' minds, I'm sure, and that is the COVID vaccines and the boosters, and what that effect may be or may not be when it comes to pregnancies and potentially getting pregnant in the future. Dr. Prettyman, I'll toss it to you first. What are you telling your patients when it comes to women who either are pregnant or want to get pregnant and the COVID vaccines?
Sure. Well, we're basically exactly 1 year out from COVID vaccines being distributed throughout the country, or throughout the world. So we've learned, I guess we've seen mostly the safety in the past year, seen the safety profile with it and seen the efficacy of the vaccine. So, the technology to create vaccines and to create this type of vaccine and an mRNA vaccine, which is what the COVID vaccine is, has been around for a long time. So I think there's a lot of misconceptions that it was a very rushed vaccine and we don't know anything about it. The scientists that make this stuff are highly skilled and knowledgeable and way more so than any of us. And, they made a very effective and safe product. So initially there was hesitancy despite the safety studies showing the safety of it. Now we have, a year of safety data, but also efficacy data. So, COVID is still out there. It's there more than ever with these variants. And we know what COVID can do. Oftentimes it is mild, but many times it is very severe, especially with patients with risk factors. And even if you get the virus and you may not have significant risk factors and you do well, you certainly are passing it to others that don't want it, right, are more scared of it, and do have more potential to get sicker than you. So it's, your responsibility to help protect others. That being said, COVID vaccine is recommended when you're pregnant. It's recommended when you're trying to get pregnant. It's recommended for breastfeeding women. If you get the vaccine before or during your pregnancy, you make antibodies that pass to your baby to also protect your baby. I think another misconception, if you will, with the vaccine, and again, the way it's been promoted and talked about, it has varied. Initially, it was we need to get the vaccine so that we don't get COVID. I think now we're kind of recognizing, especially with the newer variant, that most likely everybody will at some point get the virus. But what we're seeing hugely is that those with the vaccine, the virus, typically if you get it, is mild symptoms, maybe moderate symptoms. Those without the vaccine, much more likely to have severe infection and or death. So I think the vaccine needs to be seen more of as a protection, not necessarily to prevent you from getting it, but to prevent the morbidity and mortality that is associated with this virus.
Dr. John Sunyecz got about a minute left. Anything you'd like to add?
No, I agree with everything Dr. Prettyman said. I think our national organizations also, kind of vetted and looked at all the data and the numbers as far as the vaccine, and have given myself and all of us, I think, reassurance of the safety. And so I know in our office we actively recommend the vaccine preconceptually before the patient gets pregnant, so she has that protection, as Dr. Prettyman was saying. So yeah, I think we're a united front there.
Gentlemen, thank you very much for the time this morning. Where can folks get more information?
monhealth.com /OBGYN.
Appreciate it very much. Guys, have a great Christmas, and we'll talk again soon.